Welcome back, everyone, to Part 12 of our Explainer series. Today, we're diving into Part 12, POS 02 versus POS 10 and their reimbursement impact under the 2025 Medicare telemedicine rules. So you might be wondering, why does your place of service code matter so much? Well, selecting the correct POS code isn't just some administrative chore or simple compliance box to check off to keep folks happy. No, these codes literally dictate the accuracy of your telehealth payments. Plus, the regulatory landscape is shifting on us. Under the 2025 rules, through March 31st, 2025, patients can get telehealth wherever they happen to be located. But mark your calendars, because as of April 1st, 2025, non-behavioral telehealth is going right back to having originating site requirements and geographic location restrictions. Knowing exactly where your patient is physically located is, quite frankly, more important than ever.
Okay, let's dive into this by starting with our first critical code. POS 02 Deep Dive, Telehealth Outside the Home.
Let's take a look at the official definition. POS 02 means telehealth provided other than in patient's home. In everyday practice, this means anytime you're using telecommunication technology to treat a patient, but they are not sitting on their own couch. It represents health services and health-related services that are received virtually but entirely outside the patient's private residence. To actually use this code, the patient's physical location during your encounter must strictly be somewhere other than their private residence. Picture them sitting in a clinic, a rural health center, or maybe a hospital. That specific location is what Medicare calls the originating site, literally the physical place they go to receive your virtual care. It is all about where the patient is physically positioned when that secure video or audio connection is made. If they've traveled to a designated healthcare space to talk to you, you are definitely dealing with POS 02.
Now, here is where the financial impact actually hits your practice. With POS 02, physician services are paid at the Medicare facility rate. Why the facility rate? Well, think about it. The patient is at a separate facility, like a hospital, and that facility is bearing the overhead costs. They're paying for the room, the internet, the staff who are helping the patient connect with you, so your reimbursement reflects that shared resource. You're providing the professional service for sure, but another entity is providing the physical infrastructure to make it all happen.
Let's move to and see how this builds as we pivot to the exact opposite scenario, POS 10 Deep Dive, Telehealth at Home. The official definition for POS 10 is incredibly straightforward: telehealth provided in patient's home. Now, the technology you use to connect might be exactly the same as it is for POS 02, but this code is dictated entirely by where the patient is physically sitting when they answer your call. It's a fundamental shift in the location dynamics of the whole encounter. For this code to apply, the patient has to be located in their home or private residence, strictly avoiding hospitals or clinical facilities. They are receiving care right from the comfort of their own private space. And this code becomes absolutely vital for mental health or substance use disorder treatments. For those services, the 2025 guidelines explicitly protect the patient's home as a permissible originating site, with zero geographic restrictions. It really ensures continuity of care for vulnerable populations right where they live. The crucial point here is the reimbursement shift. Because the patient is at home, the reimbursement structure changes completely. When you bill POS 10, physician services are paid at the Medicare non-facility rate. This generally means a higher reimbursement for the practitioner. And that makes sense, right? Because without a secondary hospital involved, you're assumed to be bearing the full overhead costs of providing that care. You are maintaining your own practice infrastructure without the support of an originating site facility, so the payment structure compensates you accordingly. Let's do a rapid-fire recap because this brilliantly illustrates the core rule. It really comes down to one simple question: where is the patient? If they are not at home, it's POS 02 and you're getting the facility rate. If they are at home, it's POS 10 and you're looking at the non-facility rate. Patient location directly dictates those facility versus non-facility payment rules. It's that simple. And that wraps up our essential comparative deep dive into place of service codes for today. Up next, in Part 13 of our 15-part Explainer series, we're going to be tackling telehealth in preventive medicine, annual wellness visits versus routine physicals. We'll look at exactly how telemedicine integrates into preventive care under the new rules. You absolutely won't want to miss it. Until next time, keep your coding accurate and your compliance airtight. Decode Healthcare with Harshal.